Finally, I want to provide some clarification about the order which I issued yesterday regarding the transfer of residents from long-term care facilities and COVID-19 dedicated units. To be clear, the state of Indiana will not be ordering the transfer of any residents, nor will the state order a facility to become a COVID-only facility. This order is intended to allow facilities that already have COVID-positive patients to take others who have the same status so that they can be cared for in a way that best serves our residents, while at the same time allowing residents who are not infected to be relocated to a facility where they will have a decreased risk for exposure. Any move to create a COVID-designated facility will be initiated by the facility and will be made in consultation with the Indiana State Department of Health, with local health officials, the local hospitals, and with the local elected officials. Families must be notified before any transfer occurs. We want to make sure that a facility that wants to provide COVID-only case care has easy access to hospitals in case a patient's care or condition deteriorates. Unfortunately, we're seeing that happen far too often in this most vulnerable population. Of our 152 facilities already have positive COVID-19 cases in the state of Indiana, with at least one positive case. A total of 681 residents have tested positive across the state in these facilities, and that's about 1% of the population that live in our long-term care or residential facilities. These 681 positive cases account for about 7% of our total positive cases in the state. However, when you look at the 119 deaths in these long-term care and residential facilities, that accounts for about 27% of our deaths in the state. That's heartbreaking, but it's unfortunately an expected disparity, knowing that these individuals in these facilities are our highest risk population based on their age and their chronic health conditions. We also have had 512 staff in our long-term care and residential facilities that have fallen ill, and unfortunately, the death of one staff from these facilities. These are devastating losses for all of the families, but also for the staff of these facilities, because we know the staff, the chief medical officers, the administrators, all become very close to these residents, and it's devastating to see the number of individuals in their facilities that are ill with this disease and then sometimes losing their lives to this disease. In addition to helping facilities make the best decisions for their populations this week, ISDH pushed out an additional personal protective equipment directly to 16 of our long-term care facilities across the state, and another 21 local health departments who will be providing that personal protective equipment to long-term care facilities. We continue to send our strike teams out to test individuals in long-term care facilities daily and will not stop until we are sure we are through this pandemic. Thank you.